My biggest concern if patients lose too much weight by adding a diet on top of the toxicity, for example, that I give with the VEGF TKIs, right? So they're notorious for metallic taste, mouth sensitivity, your favorite food is not your favorite food anymore. You think your wife or your other partner or yourself, you cannot cook anymore. It's hard to maintain a healthy weight on these pills. And so to be honest with you, I'm more nervous about patient losing weight than anything. So I discourage typically any extreme changes in diet, but that's all my knowledge, so to say, and I will give it over to Dr. Abramson and see what he says from his nephrologist.
Yeah, I 100% agree with Dr. Hammers. My major concern in seeing cancer patients in my clinic is weight loss. So there needs to be enough caloric intake to ensure that there's not weight loss. Probably weight gain is needed in many cases. I think that, in very strict diet recommendations are usually not necessary until the kidney function is very low, like usually less than 30%. For example, potassium restriction or phosphorus restriction, I'm just using these words, but you might have heard of them. Those restrictions are only required if you have a very high level of either of them. So that would require kind of a multidisciplinary approach with a nutritionist. If you don't have problems with your potassium or your phosphorus, you can just like Dr. Harmer said, eat a well-balanced diet. If you want to be as super healthy, there's some literature to suggest switching some of your animal-based protein to plant-based protein may be helpful, especially if you have advanced kidney disease with a kidney function less than 30, or you have protein leakage in the urine. It may be helpful. It's not entirely proven, but it's certainly not harmful.